So this is the sixth year of this project. We get 15.9 million Australian dollars every 3 years to run this program of work across Australia. And we are just entering into our third agreement. So we will run this program over the next 3 years. And as the program grows, we make slight adjustments, going probably more from the generation of the product and the evidence really into the implementation side of things, which is well and truly on the cards for the next 3 years. So broadly, we have 4 deliverables under our contract, and really it's about connecting and providing specialist palliative care and advanced care planning advice to aged care providers and GPs. So we cover both care homes, our primary care homes and community, plus the primary care setting, to try and improve linkages between services, looking at skills training for staff, and we're also trying to get better outcomes, such as preventing unnecessarily hospital admissions and shortened hospital stays, which is actually quite difficult across a national program. So broadly speaking, because it's such a big program of work involving so many partners, we have 5 sort of different components of the project, which I'll sort of step you through. We have information and advisory services, technology solutions, workforce capacity, service partnerships, and then system capability. So the information and advisory services, we have a very comprehensive website, which hopefully you'll have a look at if you've not already accessed the resources. We have a newsletter, we have a very active social media channel. And the idea is that we have resources for individuals, so individual practitioners, some resources for consumers, and mainly we're aiming at the workforce, but as well as organisational resources, because we know that it's really difficult to change what happens at an organisation if you just target things like education at an individual level. And one of the primary things in the information and advisory services component of the project is what we call the evidence-based toolkits, and I'll step you through a couple of those. So this is the toolkits homepage. You can see that at the moment we have a primary care, home care residential toolkit. We have end-of-life law, linkages, dementia specialist toolkit, allied health, which has just recently been released. And we have our last toolkit, which is managing risk, which is coming shortly. And then we have some educational videos that are linked specifically to the residential and the home care toolkit at the moment. So if you were to go into the website and to click on the toolkits button and to click on the residential aged care toolkit, this is the way that we've set it up. So you're looking at clinical care, so really for a busy clinician in this setting, trying to take people directly to the sort of information that they would need. But we're also mindful that there's a lot of, in Australia, I suspect in the UK as well, there's a lot of education freely available. And what we've tried to do in the second component, which is the education and learning section, is to try and sort of curate that and signpost people to the best free education available. And we've got some other products, and I'll show you a few of those. And then, as I have mentioned, we have the organisational support, which is probably geared more towards sort of managers, quality people, rather than sort of the individual worker. Now, the toolkits that are sort of interfaced with the settings, such as the residential and the home care and the primary care toolkit, are primarily built around what we call the ELDAC care model, which is really trying to sort of step people around all of the essential elements that we have that would make up a really good experience for somebody that requires end-of-life care. And I think this is really handy model for the clinical people to have, because it's very clear as you move around from advanced care planning, you get to manage dying, bereavement. And so within each of those segments, they pop out and they tell you the sort of information that you need. So, for example, you can see the segment that's popped out on the wheel is advanced care planning. And so we give you some idea, what do we mean by that? What are some of the main resources that are freely available to access? And then if there's anything specific for population groups, people with dementia, people from particular groups such as the Aboriginal and Torres Strait Islander resources that we have in Australia, we direct you to those resources specifically. So that's the sort of setup under each sections of the wheel that we have. In that middle bit, on the front page that I showed you of the toolkit, we had the education bit. And as I said, we are trying to sort of curate for people, where do you find the best information quickly? And then we tell you a little bit about what's available, how to access it. We also have developed what we call our ELDAC personal learning assessment and our ELDAC personal learning plan. And the idea, excuse me, behind these is that if people need to do a quick sort of update on, what skills or confidence deficits they've got, they can do the learning assessment and then complete the plan. In the organisational support section, we have various ways to support the organisation, standards and funding, quality improvement activities, systems. And here we have an example of an organisational audit, which helps organisations to look at where they're at in terms of providing support. So as I said, we have a dementia toolkit that was released in December last year. So we are trying to, I guess, where required, give some specialty products. So that has a clinical care section, looks at person-centred care. We use the SPIC tool. You'd be very familiar with the IPOS DEM, of course, and we have some management of some focused symptoms. We will build the dementia toolkit over time. Certainly in the next 3-year period, we'll be adding information to this. There's not as much evidence on some of the sort of the elements of that care model, specifically in the dementia space. So we'll be looking for those resources as we go forward. But a really critical area is around grief, anticipatory grief and bereavement. We also have, as the second part of the program is a technology solutions program. This is led by Professor Jennifer Tierman at Flinders University, and a very active program of work. We have what's called a digital dashboard, where IT companies who run their clinical information systems within residential or home care can get a package from Flinders where they can integrate this dashboard within their existing systems, and then the organisation can get real time around, how many people have, say, got an advanced care plan, how many people are deteriorating. There's about 10 elements within that digital dashboard. We've also got a home care app, but unfortunately, as I've discovered, that in the UK, that doesn't work for you. So Australian audience, home care app, unfortunately not so good if you're not in Australia. We also have something called ProSeek, and again, this is more Australian-based, where we're trying to actually encourage people to send us their projects around the end-of-life space so that organisations and individuals can find what's going on across the country. So rather than reinventing the wheel, you can go there and see somebody's doing a particular project on something, and you can contact those people directly. We also have what's called a home care search filter, which is actually incredibly useful for the researchers in the room and students in the room or online, where it's a PubMed search, and it's specifically curated to pull out the articles around people living in the community or in home care. So that really shortcuts the search strategy work that you would normally do. We have a self-care room, which has been incredibly popular during COVID here in Australia, and I'll show you a few more of those resources later. And then we have a services, resources and technology reports section. We've got some things like becoming digital ready, which has been quite taken up quite widely by the services, and technology and innovation reports that are coming through that work stream. So really trying to inform the individuals and organisations. We have a large program around workforce capability. So we're at the moment looking at the development of learning pathways specifically for aged care staff. So for us, that's registered nurses and enrolled nurses, and then the care workers. We have a PACE app where, again, it's a different opportunity to find ways of education. And as I said, each of the clinical toolkits identifies educational options available for staff. The service partnerships part of the project is one of the largest components of the project, and it's around linking, which is one of our main objectives that I showed you at the beginning. So it's linking programs from aged care to specialist palliative care and primary care. And we have these evidence-based linkage strategies, and the services that are involved in this program work with a facilitator that's from the QT arm of the program, and they work over a sort of 6 to 12 month period where they are getting support from an expert facilitator about what do they want to achieve in their program. So currently we have over 100 services, aged care services participating, and they've got a whole range of tools that they use, like a SWOT analysis, service mapping, risk plans, and then they use the pre and post audits that we have at the individual level, so that's after somebody has died, and then the organisational audits, and they do that at the beginning of the linkages program, and they do it at the end of that program, and that gives us a shift to see whether people are making improvements as part of this program, and they use the plan, do, check, act cycle to wrap that up. The system capability, so during COVID in particular, where we have, as you would have had, a lot of staff experiencing, burnout and really under pressure. So this was a campaign called My Care Matters, and I guess it was really trying to, for frontline staff, particularly the care worker staff who are not well trained in Australia, as I know they're not in the UK, to, I guess, normalise that palliative care is part of life, part of care. How do you learn about this? What's inclusive care look like? And what's the self-care resources that are available? And as I said, the self-care room and the self-care resources have been incredibly popular, particularly with the care worker staff. So we are just at the moment writing our final report for this 3-year program, so I don't have any sort of hard results to show you. But I guess these are part of our sort of success measures that we look at in terms of the reach of our program in particular. So we have over 10,600 website users every month. We have 7,000 people subscribe to our newsletters. As I said, we have a very active social media profile with 4,700 followers. And the visitors to the self-care room was over 2,500 in the first 6 months that it was launched. And as I said, we're currently looking at the linkages program to see what impact that's had. And for two of the toolkits, the law toolkit is very, very popular. I don't know what it's like in the UK, but there's a real thirst for information around the legal aspects of advanced care planning. And particularly in Australia, we've been going through state by state and territory looking at the voluntary assisted dying legislation. So those pages are very, very popular for clinicians to look at. So you can see that in a sort of a 6-month snapshot, we have 27,000 users, 24,000 new users, which is great because that means that there's new people coming to our products all the time, and 56,000 page views. The Dementia Toolkit is also was quite popular when it was launched. We had over 4,000 users, and again 3,000 new users to the website. So launching a new product means that we get a new audience at about 12,000 page views. So we'd love to get connected with you, even those of you who are not in Australia. So you can visit us at the website. You can email there's a Flinders email there, but that just gets passed around whoever is the most appropriate person to answer your query. You can sign up to our ELDAC newsletter or connect with us on social media. And I'm happy to take any questions, Mark.
Thank you very much, Deb. So questions in the room, and I'm looking to Fliss, who's typing furiously, who knows not, who's going to alert me to any questions online. Yes, Miriam.
Hi, thanks, Deb. Great to hear that overview. I was just wondering, what kind of, do you get people making suggestions as to topics that they'd like some further information about? Is there any
yes, we do. And in actual fact, in the first 3 years, we used to run a survey that went out to all of the newsletter people where we asked, how do they interact with our products and what else do they want? We haven't done that recently. Survey responses during the COVID period were pretty tough to get, but that is one of the first things that we're going to do in the next 3 years is actually reactivate that surveys. Sometimes we do pop-ups on the website where we can ask specific questions of people. Generally, it's around knowledge around the clinical care processes, and a lot of people flag the legal side of things, as I said, very popular. When we look at the data from the linkages, we get people to actually identify their skills deficit as part of that, and so that also gives us some idea of what other products that we need to sort of build in and target. And that's partly where the new toolkits came from, the Dementia Toolkit and the Allied Health Toolkit.
Thanks, Deb. Great overview. We are particularly exercised, I think, in the UK and in Germany about the changing demographics in the population and what that means for the future of aged care. I wonder if could you say anything, do you have thoughts about how significantly are we going to have to shift the models of care, or your thoughts on that?
Yeah, so the Australian policy direction for aged care is to reduce the number of people in the care homes, residential aged care homes, and to continue to increase the people who are providing or who are getting care in the home. So we've had a massive exponential growth in the home care sector in Australia. So I think what we're seeing is that people who are now coming into the care homes, and it's a slow change, as you've probably still got some of your long stayers, but we do have about a quarter of the people that coming into our care homes will die within the first 6 months now. I've worked in the sector for 40 years, and that's a massive change over that period of time. So I think what we're looking at in Australia is that the care homes are going to be the high-end place where people are cared for. We have about 60% of people with dementia already in the care homes. That will continue to increase. However, we do also have a massive number of people on home care packages or other support within the community. We've been running a program where I don't have any results yet, where we are looking at that whole end of life in the home care space, specifically in the context of aged care. They're not funded really to provide that level of care on the current home care packages. And it's quite difficult sometimes to get that interface with the specialist palliative care, particularly in the regional and remote areas. So we will, in this next 3 years, we will have to be nimble, and we will see that shift because of the policy that's happening in the country.
So hi, you've captured me as ever on this subject. One of the big problems we have here is the kind of poor esteem that this care workforce are held in, with poor wages, fast turnover time, poor job satisfaction, etc., and also the first to be criticised for the level of care provided. Do you have any emerging evidence at all yet that you're having an impact on either the care provided, quality, or the job satisfaction for the people providing that care?
We certainly have the services that sign up to the linkages project that have that facilitated experience. We've just been in Canberra for a full day hearing from those services, and it really does, lift the whole mood of the service when they're involved in that whole of service sort of change. So I think it does help the staff feel valued. If you're providing good end of life care, you're not sending people to hospital. One of the things that's just recently happened in Australia is that we have just had a 25% pay rise for the workers in aged care, and we are expecting that to have a significant change in terms of how people are valued. For many, it will get to pay parity for working, the difference between working in the acute hospital system and working in aged care. And so we are hoping that we will be now attracting a workforce that does feel valued because they're getting paid a reasonable amount. One of the other policy initiatives that we have, which I think it will be a real game changer around end-of-life care and how people see this sector, is that we have a new funding instrument, and we have registered nurse time quarantine within residential aged care. So you have to meet a certain minutes per resident per day of that time, and we will be pushing hard, and it's part of a new standard that is around delivering end-of-life care, particularly in residential aged care. So there's lots of sort of, things moving in the right direction for us in Australia after we've sort of, we've not had a lot of reform over the last 20 years. So there's a little bit more positivity in the sector, but turnover of staff is a massive issue. Some places have 40% turnover of staff, and they are hoping that some of these initiatives will stem that. But like you, massive impact of COVID on this, and continued impact, of course, of COVID on this sector.
We have a question here from the online community. This is from Janice, who says, what can the UK learn from Australia and vice versa? Some years ago, there was the Australians sent a group of medics over to the UK to learn, and I had to tell them what they were seeing with the best hospitals in a few areas, not available for the majority. But I think it's a good question, and I do know some of the select committee inquiries that we have look to go and learn from other countries. Have you got any thoughts on that, Deb?
Yeah, look, I think that, there's some fantastic work that you would already know about, in the UK, some, terrific projects coming through on dementia, palliative care, or other aged. So I think we can always learn from each other. I think one of the interesting things is that we do have a similar sort of set up in some ways within both Australia and the UK. I guess one of the things that has really helped in Australia is that we have national standards and a national funding instrument. And so when we have this national program of work, you're actually speaking the same language across the country, apart from advanced care planning, which has legal language. It's different, but it's really easy then for us to design products that can go across the country. I'm not sure how many countries you have that luxury of doing. So I think, encouraging if there is structural barriers within your country to lobby. We do a lot of lobbying with the government and with the department. So I think, I've waited a long time. We finally got a new clinical care standard that'll come in July next year, which is the end of life or palliative care clinical standard. That will be a game changer, because if you put a standard in that you have to meet, then people have to do it. The other thing that we've done, and we're still waiting to actually see what impact it's had and whether it's a positive impact or not, is that in the care homes we've got a new funding instrument and a classification which is called ANAC Class 1. And the Class 1 is specifically for people coming into a care home who are palliative care, and there's some criteria around that, but it basically means you've got sort of, 3 to 6 months to live. You can't get into that class if you're already in the care home. So it's basically if you're coming from home or you're coming from the hospital. And again, it's trying to, I guess, encourage the movement from hospital or hospices into the aged care setting. That classification gets the highest per dollar figure per resident per day, and is assigned the highest number of registered nurse minutes per resident per day. And I think that gives a message. I think that gives a message to the sector that if you are going to be providing this care, you do need to be funded, and you do need to have the registered nurse time. So I think it's sort of elevating. So I think those sorts of policy lessons are useful across countries.
Thank you. And I guess in the UK, we've got the major conditions strategy coming out soon, and we've got a chance until the 30th of June to put in our thoughts about it, and a lot of us are talking about the dementia component of that. Another question online from Alison Bravington. Amazing project, and Alison wonders what were the biggest challenges in getting the partnership set up initially?
Yeah, that's interesting, actually. This project goes on the back of a project that was run 3 years prior to the original funding of end-of-life directions in aged care, which actually involved, I think, most of the players, actually. I think there was one new peak body came in, and we dropped, somebody. So I don't know what's like in the UK. I suspect most of you know each other. It's a bit of a niche market working in palliative aged care, is in Australia anyway. So most of us have known each other. I've known Jen and Patsy for 20 odd years. And so there is an established relationship between the academic partners that helps. And the industry partners are all very committed to being part of this consortium. We have meetings every sort of 6 weeks or 8 weeks that we have face-to-face. So even though we're across the country, we get together. And, so far it's been a happy marriage, 6 years in. But I think having a very clear, the government gives us very clear guidelines. We've got the aims and objectives of the project that we have to meet. We have very clear governance arrangements and good reporting arrangements, and I guess goodwill and collegiality across the project, because it's so important that we don't have any issues around. Everybody gets on. It's actually been a very a very successful consortium model.
Thank you very much, Deb. So I think it's time to wrap up now, so please join me in thanking Deb for her presentation.
Thank you.